Hi everyone, Tom Salemi of Device Talks, back here again to talk about Device Talks Boston. As I've mentioned in the past, we have a great focus on surgical robotics, and I mentioned in a conversation with Joe Mullings that we seem to be at a point where the whole sector is changing. New models, new technologies, new approaches are coming in. So I'm very happy to have as one of the presenters at Device Talks Boston, Bertin Nahum, who's the CEO of Quantum Surgical. He's going to be talking about their very unique surgical robotic systems. Bertin, thank you for joining us on the show.
Hi, Tom.
So why don't we just take a moment just to introduce folks to Quantum Surgical? I know in that perhaps you could give a little bit of your background, because you've done this before. You're going around for your second go around in surgical robotics.
Yes, indeed. My name is Bertin Nahum. And yes, indeed, I'm an engineer by background, and I've been in the field of medical surgical robotics for over 20 years now. And as you mentioned before, I had a previous company called MedTech Surgical. We designed and sold the robot called Rosa. The company was acquired by Zimmer Biomet in 2016. And as far as I know, at the date of today, Zimmer Biomet is declaring an installed base of over 1,000 Rosa worldwide.
Okay.
So I think it's pretty well. So now I'm here to talk about a new story. A new venture that I created with some of my co-founders in 2017 and 18, almost 6 years ago, yeah. So we are now trying to pioneer robotics on a totally new field, namely oncology.
Mm-hmm.
Epione, which is the name of our robot. Epione, by the way, was named after the name of a goddess, which is the goddess of soothing. She's the wife of Asclepius. And so Epione is used for minimally invasive treatment of patients suffering from abdominal tumors. So basically, Epione is used to help physicians delivering to the patient this minimally invasive treatment called percutaneous ablation.
Mm. So what is the problem with the limitations of the current standard of treatment?
Yeah. So first of all, one thing which is very important to explain is, that's always been the concept of my different companies, and I think that's the concept of most surgical robotics companies. We are not here to basically create a new treatment.
Mm-hmm.
Our objective is, through robotic assistance, democratize a treatment, usually a minimal invasive treatment, which benefits are undisputable, but because it is so difficult to be carried out, only a limited number of physicians can perform this minimal invasive treatment. Therefore, only a limited number of patients can benefit from this treatment. So that's exactly what we are doing in oncology with Epione. So basically, just a few words to explain what is percutaneous ablation. That's an alternative to surgery. Let's say, for example, a patient which is diagnosed with a tumor in the liver. The standard treatment will be surgery,
mm-hmm.
Consisting in basically opening, the belly and removing one part of the liver where the tumor is located. This treatment is quite efficient, but as one can imagine, is very heavy. For the patient, it takes a long time to recover, and also it's not always possible depending on where the tumor is located, and especially when there are multiple lesions. The alternative was created over 20 years ago, which is minimally invasive percutaneous ablation that consists in inserting a needle through the skin. This needle is going to be to target the lesion. The needle is linked to some kind of generator, cryo, or whatever, which is going to burn locally the tumor. So this is a very efficient treatment, which is the recommended treatment by the guidelines for early stage cancer. However, one can easily imagine that targeting a few millimeter diameter lesions with a needle on a patient that is breathing with an organ that is also moving is something which is very difficult. As a result of that, only a limited number of physicians are capable of performing safely this treatment. Therefore, only a limited number of patients can benefit from that. So our objective, our mission is to democratize through robotics, help more physicians, therefore more patients benefiting from this treatment.
And how is Epione able to do that? What abilities do you give it? Do you give the surgeon that they don't otherwise have themselves?
So we are in something which is quite common in robotics, which is so-called image-guided treatment.
Mm-hmm.
So basically, it's always the same paradigm. You're going to download the images of the patient. In this case, this is a CT images. On a console, you can recreate in 3D, the patient anatomy. You're going to plan virtually the ideal position of the needle. You can basically define virtually quite a few parameters. I'm not going to go too much in details. And once this is done, this information is going to be sent to the robot, and the robot is going to position automatically a guide through which the physician is going to insert the needle with, knowing that the needle will be exactly on position. So that's roughly speaking what the robot is doing, which is very similar that what you're seeing, you can see for many image guided robotic devices, like Rosa, obviously, but also Mako or other.
And final question: where are you in your commercial rollout? I know you're here in the U.S. now. Give us a sense of what Quantum is looking forward to over the next year or two.
So we are at a commercial stage, meaning that we have already sold this device. At the date of today, over 400 patients have been successfully treated thanks to Epione in Europe and in the US. We have done our first installations in the US. The first hospital to acquire the system in the US is Baptist Hospital in Miami. And I am here in Miami, in the US, to basically, conduct, the deployment, the commercial deployment of our technology in the US in a very similar fashion as what I did maybe 10 years ago with my previous company, when it was to basically deploy, the commercial, deployment of Rosa in the US. So that's what I'm doing right now.
Exciting times. Well, I appreciate your taking a day out of your busy schedule. I'm sure to be part of DeviceTalks Boston. Again, people can come and hear the Epione and Quantum Surgical story there. And Bertin, thank you for joining us today on the show. Appreciate, very grateful for the insights and the time.
Thank you, Tom.